panel for coming along, and these guys are early to mid-career researchers, and we're going to talk through all the issues you wanted to ask but have been too afraid to ask of those old professors we've had all day. So I'm going to start by letting the panel introduce themselves and give you a few minutes about how they got to be sitting on this chair. So Kirsten Palmer.
Good afternoon. So my name's Kirsten. I'm a maternal fetal medicine specialist, which most people have never heard of. So for ease, I'm an obstetrician, and I work at Monash Health, where I head up the maternal fetal medicine unit at Monash Medical Centre. And not unsurprisingly, I'm a clinician researcher, so that's my clinical job and what I do. And essentially what that involves is caring for women going through pregnancies that are the most complex pregnancies that we see here in Australia. So women with really significant medical conditions that are going to impact on their health during the pregnancy, or they're having pregnancies that have really significant complications that arise, and they include fetal medicine as well, so really significant medical conditions that impact on the fetus. So it's the best area of medicine. It's just fantastic. You get to do medicine, surgery and imaging with a lot of ultrasound as well. But then I do combine that with life as a researcher as well, and head up the maternal and perinatal medicine translational research group over in the Department of Obstetrics and Gynae. But like many talks that you've probably heard today, it has not been a straight linear path to get to that position. I did not know what I wanted to do at the end of high school, so I went and did a Bachelor of Biomedical Science because I loved science and I knew that's where I wanted to go. I was in the first cohort here at Monash University, and it looked extremely different when I came through here as a student to do that degree, and then managed to get a job at VIC as a science student as part of their undergraduate research opportunities program, working with Doug Hilton there, and he was certainly one of my first mentors. And I stayed on at VIC then for the next 7 years working in cancer and haematology research. Absolutely loved it, but realised I wanted to do medicine during that process, and then went in as a graduate student at the University of Melbourne and went through there. And then jumped on to the medical pipeline that happens with intern and trying to decide what you want to do, applying for specialty programs, and decided I want to go down the pathway of women's health at that point in time. And not long after starting on my specialty pathway, I jumped off the pipeline again and went and did a PhD quite early during my specialty training, so pre-exams. And then also decided to start a family during that period. And so I had the joys of trying to juggle kind of postdoctoral life, specialty exams and a young family all at once, which is certainly not something I recommend. And basically spent the next kind of decade of my life juggling all of those things through specialty exams and then also subspecialty training for maternal fetal medicine. And then now have come out the other side of all of those years of struggles, still juggling a lot of things, but now getting to work in this, really exciting space and doing the job that I absolutely love. And I think, like we've heard as well, it's constantly evolving, constantly changing. I've had the opportunity to do work with Department of Health. I'm doing, work in a whole range of different areas with different specialty groups than what I ever would have thought that I would end up doing. And it constantly evolves and changes. So a highly exciting time.
Great intro, thank you. The next panel member is Dan Steinfort, and he is actually an Academy mentee. And if you recall, at the beginning of the day, I told you these are for the future leaders in health and medical science in Australia. So it's great that he's part of the Academy. Dan, would you like to tell us about you?
Thank you, Ingrid. So I'm Dan Steinfort. I'm a clinician researcher. I'm primarily a respiratory physician based at Royal Melbourne Hospital and Peter MacCallum Hospitals. And I also work part-time in clinical, mostly clinical research, but a small amount of translational research with some of the collaborative groups within the Parkville precinct. I slightly differently, I actually went straight into medicine out of school, which I know is a lot harder these days. And at that stage still wasn't certain that that's what I wanted to do, but certainly wouldn't have thought that I'd be here that long ago, not because I didn't want to be here, but because I had no concept that this sort of pathway really existed. So you guys are actually a long way ahead of the curve just by the fact that you're here and thinking about it already. I obviously sort of went through medical school, went on to do my intern and junior medical years, which I enjoyed, but which probably didn't give me quite enough interest and variability, and so I made the decision to do a PhD at the end of my specialty training, and that's obviously it took me about 4 years, but I've found that to be probably a fantastic thing to have done, just because I think clinical work, for those of you that are headed down a clinical health pathway, I found sort of, if that's your 50-hour week, that's a really tiring week, whereas research is a really good balance. I think you sort of can take the best bits of both an interesting clinical career, but if you're doing that all day, I found that became a little bit Groundhog Day, and so the research meant that you had longer term goals that really sort of motivated you, or motivated me, much more than they did. And so I've never planned too far ahead, 2 or 3 years at the most, but a few things sort of fell into place, and after my PhD I was able to get a fellowship which essentially just supported more clinical research. So you do need quite a bit of luck, but what you really need, I think, to make it as a clinician researcher is the sort of things that people were talking about in the earlier session that I was hearing, mentors and sponsors just to help you forward, and particularly probably beyond your PhD years, you need collaborators that are good to work with. And one of my mentors told me the best thing about research is every day you get to choose who you work with. You don't have to turn up to a job and work with people you don't like. If you don't like them, you just go and find someone else to work with. So you're always working with people that are interesting, that are inspiring, and it's I find it a really good professional balance.
Fabulous. You're next, Trish. Trish Peel, please tell us about you.
So my name's Trish Peel. I am a infectious diseases physician, and I do research as well in large-scale clinical trials about how to prevent surgical site infection. And the other aspect of my work is how do you introduce programs to help people use antibiotics wisely, so antimicrobial stewardship. And I do that in Australia, but also I work in international settings. So I work in Pacific Islands, in Papua New Guinea and other centres. But I guess the theme with everyone is, if I looked at myself when I was in med school, or even when I started my PhD, I would have not have thought I would be here. And in fact, my story is probably what in some lights you might think of as a series of cock-ups that got me where I was, or just misadventures that I was able to capitalise on. So I did infectious diseases training, and as part of my training we kept seeing orthopaedic infections. Talking to the orthopods, they kept telling me it was just a mere scratch, it wasn't really a serious infection. So that really prompted me to start going on and inquiring as to, was it a mere scratch? Did it actually impact on things? So I started to do research just really for my own interest, and that sort of turned into a PhD, where I was actually an infectious diseases doctor who became an honorary orthopaedic. Not that anyone would want me to operate on them, I can't cut in a straight line. But then I did my PhD in that area. But I was going to be doing my PhD looking at how to diagnose these infections, and the day before my PhD confirmation, the company I was working with went bust. So suddenly I had to actually do a different route, and that was actually quite a rewarding route for me. Similarly, I was due to go to Mayo Clinic for my postdoc fellowship, but my funding fell through, so I only ended up being there for a year, which was actually quite good because it meant I came back and really reflected on what I wanted to do in my career. Similarly, when I came back, it was hard to find some work, so one of my very good mentors suggested that there was this thing called antibiotic stewardship, and would I like to do some work in that? So obviously wanting to earn some money, I embarked on that, but really I found that such a stimulating thing. And then I guess to form the arc back to how I ended up in clinical trials, we were working with orthopods and other surgeons, and they weren't following the guidelines, and we we wanted to know why they weren't using the antibiotics appropriately. And then when we worked with them and went back and had a look, the evidence wasn't that great. So then we started thinking, well, let's actually form the evidence. How can we actually change things? How can we actually, you know, bring the surgeons along, make a change in practice? And so that's really what gave birth to the trials that we're now doing and a lot of the work that we're doing. So again, it wasn't a linear path. It was very much a sort of snakes and ladders, but certainly is has been a very rewarding and exciting journey.
Thanks, Trisha. I think you highlight a number of issues. One is serendipity. The second thing is everything goes wrong and you have to then pick up the pieces and find the next bit. And often that ends up being a whole lot better than what you were going to do in the first place. And I think that's about the fact that it'd be nice to control your life's journey and say, well, I'm going to do this year and this year and this year, but that's not how life works. And it's about picking yourself up, dusting yourself off and taking the next opportunity. And then asking important questions is something else that I think people have said, but maybe not really said it well enough in terms of with research, you can ask a billion questions, but many of them aren't important. So if you're going to embark on a research journey, make sure the question you ask is important and that you can answer it. You know, you can't solve the world, you can only solve a question. I think we often think we're meant to solve the world, but you're not meant to solve the world. Okay, so the last member of the panel is Dr. Sindhu Viswanathan. I don't know if I can say it right yet. So I asked Sindhu to come. She's a bit more junior. She hasn't got a PhD yet, but she's got a lot of experience in her field, and she's come to work with me from Malaysia. Only arrived a few months ago. Thank you partly to good old COVID. And I wanted Sindhu to tell you a bit about her story.
Hello, everyone. So my name is Sindhu, and I'm from Malaysia. As Ingrid mentioned, I'm a few months old, 2.5 months old in Australia, to be precise. My journey started off very differently, and I come mainly from a clinical background, and I'm trying to claw my way into a bit of research and hopefully find a bit of balance there. And so I started my internship in a very rural place in Malaysia, and it's in the state of Sabah. And it was a very overwhelming experience, I'd say, for a young person to be working in a place like that. You had a lot of immigrants with no vaccination, a lot of poverty, and, you know, a lot of days I had to kind of make a lot of big decisions as to whom I was going to give a bed to and who wasn't going to get a bed, and all that at a very young age. And so research was very much seen, even till today, as a secondary thing where I come from. And in the clinical side of things, you pretty much don't really get that much of a balance. I went on to do pediatrics, pretty much not planning for that. I was very much interested in surgery, but I didn't want to come in late in the morning, early hours of the morning, and so I decided I'd probably do a more medical-based field rather than a surgical-based field. I wanted to complete my master's in pediatrics, and at that time, from all that experience that I had, I was interested in infectious diseases. We saw a big cohort of all sorts of infectious diseases that, you know, one would otherwise only see in textbooks, from cerebral malaria to TB meningitis, and they would come through your doors from 3 countries, Indonesia, Philippines, and Malaysia, every other day. And I kind of gravitated a bit more towards neurology because I felt it was a whole lot more complex and it had a lot more questions than answers, and I liked that not knowing bit about it. And I found that the neurosciences were really making a lot of advances, and I wanted to be a part of that. But that said, it's not easy to get that kind of a balance in the Ministry of Health where I work. And so I really wanted to come out and get a bit of that research, and it's taken a bit of time, but I find myself now in a research powerhouse, I might say, and and I absolutely love it, because I think when you have research as part of your clinical life, you get a chance to ask questions and try to figure out that answers, and that deepens your understanding. And I did not know what I wanted to do for a long time, and to be frankly honest, I'm still coming into it. But it's been a nice ride, and I don't think I'd change anything up to this point, yeah.
And you're 16 years. Was that post-med school?
Yeah, so I graduated 16 years ago. Yeah.
So just to show you, it's not a rush, it's a journey. And also to reinforce something that others have said today, I met Sindhu when she spoke at a meeting, I don't remember what it was, Asian Oceanian Child Neurology probably, and she gave a series of 12 patients with potassium channel very severe epilepsy. And then she came up and chatted to me and said, oh, she might like to come here. And I said, well, I thought your talk was great, which is a great way to impress me. And so she's come for a year on Malaysian funding, but I have now put aside funding for her to stay another 2 years if she wants to do a PhD. So I'm just telling you that's how things evolve. You don't just get handed it on a plate, it just happens. So thank you all. Now I am keen for the audience to ask questions, so if you could signal if you've got a question. I'm going to ask you an online question, but pop your hand up and our wonderful mic bearers will run to your side. Now we've got quite a few online questions, but I'll start. There are quite a few around PhDs, and one we've been keeping from this morning, which was, if I want to do a PhD overseas, is it recommended and are there any disadvantages? And I'm concerned about losing my professional connections in Australia. So who'd like to have a go at that? All of you did PhDs here. Oh, yes, have a go at that, Trish, thanks.
So I did my PhD here in Australia, but then went and did a postdoc in Mayo Clinic, which was a great experience. I'd come out of training, I was still in the eyes of the clinicians I was working with, still the registrar or still someone very junior. Going away overseas, it meant that I kind of came back as the expert, so actually I think it really helped me in my career, and I guess, and also, I think it really did help. But I think the important thing is, it was aligned with what I wanted to do. It was working with people who I wanted to work with. So I don't think it matters whether you do or you don't. I think it's that you should, if it's something that you love, if it's something you're interested in, if it's the people you're working with, then I think it's a great opportunity. But I don't think you necessarily have to do it either for the kudos or because you think it will help you in your career. I think if you go somewhere just purely for those reasons, you may find it an isolating and a lonely experience and not actually help you at all. So I think if the reasons are right, then you should embrace it.
I think a PhD, you're going to be away for a long time, and I think it's a good thing to be mindful of, that you lose connection to your clinical peers back in Australia or in Melbourne, wherever you are. But if you are going, I'm presuming that you've put a lot of thought into it, and probably the best thing to do is to be talking to your peers in Melbourne now, so that they sort of know what you're doing, so that they, because you can't just turn up in 3 years and knock on the door and expect to have an appointment or a fellowship, whatever. So you've got to be sort of planning 2 or 3 years ahead, and so you almost need to be planning your return.
And you need to keep badgering the bosses, don't you? When you come back, every time you come back, you make an appointment and give them an update, have a coffee with them. I think that connectivity is really important.
Yeah. The only other factor as well, really building on what Daniel just said, is also it really depends on what your underlying clinical job is to some extent. And I think that if your clinical role does contain a procedural component, you are going to need to maintain that procedural capability still whilst you're doing a PhD. And that might be challenging depending on where you want to go overseas, that you may not be able to continue to work as a clinician, recognising that countries have different requirements on that front. So I think also just in considering if you're going to go overseas to do a PhD, if you're going to continue to have some underlying clinical work still as a component of that. And I certainly would recommend that no matter what you do, because stepping out of any medical career for 3 years, it is such a fast-moving, constantly evolving space. That's a long time to step away completely from patient care and then to come back into it. So obviously I did mine in Australia, but it's just something to bear in mind.
I think it's a really good point around a PhD and probably more around a surgical specialty. If you're doing a clinical specialty, you're often going to do that while you're overseas. And, if you're in England or in America or wherever you might be, you'll be seeing patients, so you don't have that loss of touch and loss of fine motor skills that the rest of us have all the time. So I think that's important. The other issue that Dan brought out is a PhD is a long time. It's sort of a minimum of 3 years, often 4 or 5. And if you were me, it was 8 and 2 babies in the middle. But I think that it's a postdoc overseas is wonderful, and nobody can really tell you how amazing that overseas experience is. So although you don't have to do it nowadays, it does change your worldview permanently and create connections permanently. So I don't want you to just think, I don't have to go, because you will get something out of it. There are 2 questions that actually follow on from that, which are there any barriers to interrupting specialty training during a PhD, which you've sort of dealt with, I think. I heard some training programs don't let you interrupt for more than 2 years. I don't know if anyone knows more about that. I don't. Are there any barriers to returning to clinical practice from a few years of research? Did you have any issues with returning to clinical work? We've heard about the story, we've really heard the surgeon's story. Did you have any problems, or did you just keep it going?
So I did my PhD in Melbourne and continued a small clinical appointment, so it wasn't an issue. But I think the answer to that would depend on where in your training you are. So I think if you've completed your specialty training, that's probably a great time to go be absent for a period. And in fact, you've completed your training, so there's no barriers. It does sort of make it a bit harder, I would think, if you're doing it in the middle of particularly in the middle of specialty training, because you sort of everything, your knowledge builds on itself, and to interrupt that would be challenging. But I think there are programs around that help support that, like the MAC track program at Melbourne Uni.
Yeah, we heard about that earlier today.
Yeah, good. So I think as long as you sort of advertise it to your sort of senior colleagues that this is what you're doing and this is why you're doing it, you're probably more likely to get support than pushback, I would think. But you just got to keep talking to everyone.
Trish?
So I had a 12-month disruption while I was over in the US. And when I came back, I don't know whether it's just general imposter syndrome or anyone, I felt very rusty when I came back. But you pick it up very quickly and you sort of get back into the stride. The other thing is I had a mentor who gave me some very good advice. It's sometimes hard to disrupt your research career because they often have a trajectory and a general momentum. But he said you can always sort of do upskilling courses, shadow people and really pick up your clinical skills as well. So, I found that quite helpful because I was worried about disrupting my clinical career, but doing those things really got me back on track, and I felt then I was able to bring the research strains into what I was doing as well. So it was all in all quite a good course of action for me, I think.
Great. We'll take your question.
Hi, thank you very much for running the panel today. I have 2 questions actually. All of you are in quite leadership roles, and I just wanted to know the skills that you need to be a good leader and in these positions. Did they come quite organically? Did you pick them up along the way? Did you do extra training to be able to support what you're doing now? If you could just talk to that and thanks.
Look, I think it's kind of one of these kind of inadvertent things, and certainly I don't feel like I've been organised like Dan to plan 2 or 3 years ahead. I just keep saying yes to things and it just kind of organically evolves. But I certainly don't think, you don't get any really proper training in leadership at all through medical school or through specialty training programs. So leadership is not really something that you get any skills with, and then suddenly you'll find yourselves, as you get naturally further through medical training and you become an advanced trainee or a senior registrar or a fellow and then eventually a consultant, you're automatically becoming a leader as you take on those roles and providing leadership to the junior teams that are working below you, whether you were planning for it or not. It will happen to all of you. But certainly there are increasingly a number of programs that are now available to actually give you exposure and training in leadership, and certainly they are wonderful to be able to take part in, and they'll open your mind up to whole new ways of thinking about things that you just don't get exposure to through the classic kind of medical or research pathways.
I think my leadership kind of evolved fairly osmotically / zigzagged a lot. We weren't given any sort of formal training, but one of the things I took on board was looking at people who inspired you, so good leaders, and thinking, all right, what qualities do they bring? And you get a lot of opportunities to actually observe people. Actually, probably the best lessons I ever had was watching bad leaders and seeing what they did and seeing, what they did in a team, how they treated team members, how they treated junior members, and almost that gave me a signpost to go away in a different direction. And so I think that was really helpful for me. So you take on those qualities that you admire, but then work to not have those or to really push back against the bad qualities as well.
That's a great answer. Dan, did you want to add anything?
I agree with all of that, it is something mostly that just develops, and particularly if you do research or, a fellowship, immediately people look to you as more knowledgeable or expert in that field, and so you become a leader in that sense. I think leadership in terms of leading a large team is very different, and I don't think I'm that. I've got sort of a research group and a few PhD students, but that's just sort of working one-on-one. So I think, I don't feel like I'm there yet, but it's just still continuing to build over time. I think we did go to a leadership course once and it was absolutely terrible, a complete waste of a week. So there can be good ones and bad ones, obviously. But I think sort of watching people around you, and I think self-reflection is really good. How am I impacting people, and am I acting in their best interests, or am I just trying to railroad them? I think that's often one of my sort of senior people said, you've got to always be making sure that your decisions are good for the people underneath you, and that was what kept him on target. But I think, if for people who sort of have a good degree of insight and are happy to question themselves, I think that's probably a fantastic basis.
It's lovely responses. I think you're right. It's organic. You just learn it because you have to. It doesn't mean we're doing that well. I mean, maybe we should be doing more leadership courses, but who was it? Who said before, don't pay for an expensive one, but good leadership is really modelling too. Do one, see one, teach one, we say in medicine, and you pick the people that you learn from, and then you model them, and you try and do a better job. Like, you don't pick their issues or their negatives, you only take their positives. So I think the really important insights there. And, leadership keeps happening even at my age and stage. So it doesn't just happen when you're young. And even the presidency of the Academy, my immediate response when the first president rang me was, there's no way I can do that. And then a few people close to me said, yes, you can. And I thought, I don't think I can. But it's really interesting. And, I disagree with, who was it? Was it Christabel? Or I'm not sure who said there's no imposter. No, it wasn't Christabel. It was Helena who said it's not an imposter syndrome. It's it's the infrastructure, if you like, the culture. But I think there is an imposter syndrome, and I do think it's more in women, but I think men can have it, so you don't get out of it that easily, men. But I think very much I've always had that, you know, I can't do that, I can't do that. And then I found it. And in fact, you know, I became vice president of the academy before I became the president, and I realised I was, apart from the president, the only person who was a fellow of the Royal Society in the room and a fellow of the Australian Academy of Science. I thought, oh, well, maybe I can do this. So just to tell you that doesn't necessarily go away, but you have to look at it and go, like Jodie said, I think I can do this. So that's a little bit about training yourself to think a bit differently. Did you have a second question?
Yes, thank you so much. That was really great. My second question is about when you're doing research. I guess in my mind, I've always thought that you would focus on your particular area where you work in. Yeah, and so then I wondered, are there actually lots of opportunities to do collaborative research with other specialties within the institute that you work with or within the hospital, and do you go and seek those out, or yeah, how does that work?
So my whole basis of research is collaborative research. So I collaborate with, the government. I collaborate with surgeons, anaesthetists, and even more so now with the patients, so trying to understand their journey and their perspective. I think research can be this wonderful winding course, and often it's driven by your curiosity. So, for example, I wanted to know why my surgeons weren't following the guidelines, and so I went to them and started talking to them. And so that conversation, or that question that I had that turned into a conversation, turned into my research project. I have been fortunate in many ways that I've been able to actually drive my research journey. So I haven't had a prescriptive, you're going to look at these things, you're going to answer these questions. And I think that's been a bit terrifying, because you're suddenly having to do it all yourself, but it's also been just so fun, and you get different perspectives. You hear what anaesthetists think about things, which is different to what the surgeons think about things, which is different to what government and what patients think about things. So that's probably that collaboration, understanding different perspectives is probably the most enjoyable aspect and the most rewarding aspect about clinical research, and probably medicine as well.
I would agree, and I'm the same. I didn't mention what my research was. I work. My subspecialty is in interventional pulmonology, so bronchoscopy, cameras into the lungs for diagnostic procedures, and so as a result of that, a lot of my work is in lung cancer assessment and staging, and so that immediately means I'm working with radiation specialists, surgeons, oncologists, and most of the questions that we're interested in answering actually require 2 or 3 or 4 specialties to be contributing. So it's almost impossible to do non-collaborative research, I think, but particularly in a clinical setting. And the other thing I think is that if you want, we were talking about, Ingrid mentioned impact before, if you want to do research that's actually going to impact, you have to be answering those questions in a way that will engage those other groups anyway. You can't just turn up and tell them your answer. So Trish would get nowhere if there wasn't buy-in from the surgeons in her post-operative wound work. Or
they don't do what I tell them to do.
So yeah, so unless you've engaged them, you can have as much data as you like, but it's probably coming back to that communication question before. You have to have them buying in and willing to sort of run with what you find, and if you haven't done that, your research probably isn't going to go far.
Did you want to add?
Look, just really ditto. It's absolutely fantastic, and likewise with Dan. The research that I do is mainly looking at placental disorders, but not only the impacts that they have on the mother, but also the impacts on the fetus. And so for that, we're needing to suddenly move into the space of childhood development, neurodevelopment, childhood research, cerebral palsy. So that's meant that I now get to work with a phenomenally diverse team of neurodevelopmental psychologists, neurologists, neurologists. I work with cardiologists because mothers with placental disorders have increased risk of cardiovascular disease in their future. Epidemiologists, statisticians. You get to work with such diverse ranges of people, which is always so fascinating because, I think the joy of being a student is that you just get exposure to such diverse areas, and you lose that as you start to kind of specialise and move off down your pathway. So it's wonderful actually being a clinician researcher because it gives you that opportunity again to really just embrace your curiosity and get to learn from so many phenomenal people around you.
And in some ways, this won't mean so much to you, but you were here, I think you'll be more of a hedgehog, but working with a whole lot of other hedgehogs with their, maybe doing the fox story as a multi-hedgehog manner. Now, Sindhu, there's one for you. Why would you want to come to Australia from Malaysia?
Yeah, so I think Australia is a phenomenal place for research, and I know I'm only a couple of months in, but this is just my first-hand observation, and I'll share that with you. So just in this 2.5 months that I've been here, like the desk next to me, for the first couple of weeks, there was someone from the Netherlands, and she was a medical student who's finishing up her PhD in movement disorders, and I got to get to know her, and she came all the way from Europe. Just a couple of weeks after that, I had another professor in pediatric neurology come here for 3 weeks. And, that kind of tells you that this is also one of those places that people go to for PhDs. And I know for a fact that I'm a little more familiar with the Asian Oceanian movement from all the conferences and things like that. So I'm aware of the things that has been put out by this team, and I would say that it is top end, and the cross-collaboration that happens here in Australia between the units is something that's very palpable, something that's been happening, and I wouldn't see why not. It's nearer to home, and it's just as good, and I think it's also a leading powerhouse in research in the medical fields, and so that's why Australia and what I want to do and who I want to learn from is here. So
I just think we've got another 4 Malaysian neurologists, adult neurologists. Sindhu's paediatric, and a Japanese adult neurologist, all in our fellows group at the moment. And these fellows form friendships and collaborations for life. So, when we go to the American meeting, we all meet up and we actually have a big dinner of about whoever of our babies are there. I call them our babies. The adult doctors don't call them babies. But we would have trained about 60 international people, and quite a few of them are professors now. So just to tell you that is one of the fun areas about being part of a research group. Now, I see you've got a mic, so I'll let you go first.
Thanks. So there's been a lot of talk today about the timing of a PhD, but also about really non-linear journeys. So I'm currently a PhD student, and I'm planning to do medicine after I finish. What advice would the panel give to people in my position in terms of building a career as a clinician-scientist?
Yeah, it's a really good question, and it is one of those really challenging things because you build so much research momentum during your PhD. You're going to conferences, you're meeting amazing people like Sindhu has with Ingrid, and you're starting to really build this momentum, but you're also gaining a maturity of thought in terms of actually coming up with research hypotheses, questions that you'd like to explore that can just flow then very naturally, potentially, into your postdoctoral period. And it is really challenging when you need to step away from that way of thinking and moving back into a clinical environment. And, often then you will take a little bit of a research hiatus in a way with doing that. So for me, when I finished my PhD, I had to go back into full-time clinical work to actually meet my college training requirements. So it meant that I could not do any dedicated research time. Whatever I was doing just happened in my free time. And, certainly if you look at my career trajectory, it's certainly pretty minimal for those few years there. So I think, that may happen. I think the benefit is that the colleges are increasingly gaining in respect for clinician researchers, and there are constantly changes that are happening to actually improve the ability of people to undertake this as a viable career opportunity. I've certainly seen a huge amount of change in my field in that space over the last decade, and I suspect it's happening in many, many fields. So hopefully that will mean that that pathway for you will be much, much smoother. During medical school, so easy to keep doing research through medical school. I had a full-time job in research during preclinical med. You know, like medical school now is not challenging, and the contact hours are minimal compared to what it was in the past, that you absolutely can maintain ongoing research productivity whilst training to be a doctor. Once you start work as a clinician, it's a little bit more challenging because the hours are much more longer, it's much more intense, but it's absolutely possible. And I think with good support, good mentors around you, there's no barriers.
Dan, do you want to?
I was, well done on having that vision and plan, I think. I was going to say something slightly differently, actually. Having not been in the situation, you know, Kirsten has, and so clearly it can be done. I was sort of going to be suggesting that there might be a period where you're going to have to go a bit easy on yourself and not expect to run two concurrent careers. But what you will have is that a lot of your peers won't have is an idea of what the future might look like. And so, you know, rather than planning 1 or 2 years ahead, you'll have, you know, research ideas running through your mind as you're doing your medical studies, and then during your junior medical doctor years, and you'll be much better at spotting opportunities and capitalising them. And so I think just sort of keeping it relatively forward in your mind. The other thing is just to keep talking about it, particularly once you get to be a junior doctor. You know, senior doctors love nothing more than someone who's going to help them do good research, and they can help you frame. If you start sort of announcing that early and they know that you've got good research skills already, you'll get a lot of support to start to develop a really good program. But, you know, maybe there won't be a big hiatus, but, you know, that you might have to sort of expect there to be a period where your productivity is low, but your thought processes are high.
I guess the other thing is just to reframe or rethink what you think research is. And in medicine, you're always learning something or seeing something, and then you can go back and look at the evidence and try to understand it and ask questions. So the skills you have acquired through your PhD, you use them every day in medical school, you use them every day in clinical practice. What research teaches you is a framework to take it beyond just questioning. So how can you take it beyond that to examine that? So you will still be doing it through medicine. It's just, you know, you'll do it in slightly different ways, or you'll be asking different questions, or you'll be exposed to different things. So I think it's wonderful that you have that skill set and you won't lose that, and you won't lose that curiosity.
You'll be a better clinician because you're a researcher, as we saw on one of those slides, and a better researcher if you're a clinician. So it goes both ways. Now, we've got this fantastic question online, so thank you to the person. I'm a full-time clinician and a senior clinician with 10 years at consultant level. Is it too late to be a clinician researcher? Dan?
I guess one of my, not quite a mentor, but one of my senior colleagues who I admire greatly, who's in Brisbane, is actually internationally renowned for his skills, and I think he's 20 years out from his specialist qualifications, and he's just started a PhD. And it's going to be an incredibly impactful PhD because he knows exactly what question he wants to ask. He's got the framework to ask it. He's got a whole lot of people who recognise his kudos and so are keen to support him perhaps more than they would someone who's a bit more junior. And so I think the key is having an idea of what you want to do in research, but there's never I would say.
Never too late. Any comments?
I'd be first to agree to that. Never too late. I've been a clinician for 16 years, and I think that, you know, coming from this side of things, like after having quite a long long bit of clinical experience, I'm a bit more, in a way, clear of what I want to ask and why I want to ask those questions, and, you know, what exactly I want to be gaining out of this whole thing. And I think that, you know, that bit of maturity brings a slightly different twist to that research point. And I think it's never too late. And yeah.
I think you've beautifully articulated that, and I can tell as a supervisor, having a more mature PhD student that is an adult and owns their PhD is a sheer joy. I've got one of our research assistants who is now becoming a bioinformatician. Well, she is one, but she's now doing a PhD. And it's just heaven on a stick as a supervisor. It's so much easier with someone like that. So it really makes a difference. Did you want to answer that? I didn't give you an opportunity. All fun? Oh, yes, Trish.
I mean, the other thing is that you can be a clinician and still contribute a lot to research. It might not be that you're putting in funding or doing a PhD, but actually you can really make wonderful and meaningful contributions to research. One of the things we do is we have multi-site trials, and we'll bring a clinician on as a site investigator, so they get exposed to research, they make wonderful contributions, they ask questions that we hadn't thought of, so they're contributing without having gone formally down that academic pathway. So you don't have to have done a PhD, you don't have to have NHMRC funding to actually be a clinician researcher.
Really important point. Thank you. Now, question there. Sorry to keep you waiting.
Thank you so much. And I know that all of you are working in a health-related area, but actually I am not a medical student. I am now currently studying a psychological science degree for my last year, and I am planning to have a Master of Public Health program last year. And could you give me some advice that how can I find a job in the mental health or just health related area after I graduate? Because I know that the public health is not a very specific area.
So how can you get a position after you've finished your Masters of Public Health in that field? Who would like to take that? Yeah, Trish.
Probably one thing to say is a lot of research was, quantitative. We got a p-value and then we told the doctors this was what the trial showed. But a lot of things is actually then how do you get people to change? How do you bring people along? So behaviour change, bringing on different skill sets. So we're working increasingly more with people with that sort of humanistic background who understand human behaviour and try to help with that. So there is a real understanding, and there's been a real groundswell in all aspects of research funding, but also research about how do you translate, how do you make an impact. So we work very closely with qualitative researchers who are not clinically trained. They've often come from psychology backgrounds, and they really bring this fantastic different viewpoint into why we're not making any headway with clinicians, or why evidence isn't being put into place. So there are a lot of opportunities opening up. So I know a lot of schools do have qualitative programs or behaviour change programs and things like that. So those things are worth looking out for. A lot of it's, you might be looking at getting a research assistant position where you begin to get an idea about what research is. You don't necessarily have to have the full hand of skills. In fact, what I look for when I employ someone is someone who is motivated, inquisitive, shows initiative, rather than someone who has, the tick box of all the skills. So often sort of trying those positions, working with people, again, your career won't go in a straight line. You'll sort of work with some people and then you might move over to somewhere else, and then, it does sort of zigzag up. But just getting that experiencing, getting that exposure, being open about what you're doing, having a really, taking chances, taking a different path, often is the best course.
And I don't know about public health, but this is sort of a general comment, but I guess in the same way that the three of us have PhDs and Sindhu very soon will, except although we've all got PhDs, we've all got very different skill sets. It's the same for an MPH. It's an incredibly broad area that you might have studied, but you'll have chosen different subjects. And I guess one of the things that might be useful is to think about what particularly interests you and what you are particularly good at, and that then becomes the point that you sell yourself on or that you develop yourself in, because in the same way that we've done PhDs which helped us become recognised for a particular very narrow section of our specialty, that's, I think, probably what you might need to look at doing. And if you put yourself in the position of a potential employer, why do they want to hire someone? They want to hire someone who's got a strong skill set in this particular area. So I think rather than just assuming that the MPH is one and is just an outcome in itself, you need to perhaps think about what it's delivering for you and what it's particularly making you better than other or exceptional in.
I also think you shouldn't expect that you can walk in and do everything, because you're just finishing your student life. It's like the medical students, the day they start their internship, they're just really learning the job on the thing. It's a completely different world. And I just think because you've got a Master's of Public Health is wonderful, but it doesn't mean you already know how to do it. And many people would start life as a research assistant, and then you're learning and watching those around you, seeing how research groups work. And there's a million ways you could go. So it's very exciting. But just don't expect you're not meant to know it all yet. That's what life's about, to come along and learn. Now, we're getting very short of time. I think there was a question here. No, please.
Sure, thank you. I actually have a question. It's just for the general panel. It's just with regards to, so previously I actually took on a role as a research officer here at Monash. But then I had to take a pause because of my other job that I have as full-time at a grassroots level organization. But then my question is, how do I then, I guess one of the aspects is time, but I think it's how do I then go about, because my passion is in policy and research actually, then going into a career in research and in your time as a researcher, what was the challenge in relation to staying motivated as well to finishing your PhD and also then working through it in research? Yeah, that's my question. Thank you.
Trish, do you want to start with it? What was...
Some advice I got from a clinician when they were doing PhDs was a PhD is like an unrequited love affair. You do put your whole body and soul and into this thing, and you want it at the end to love you back. And there are moments when you're doing a PhD, like everything, you won't love it, but it's just maintaining that inquisitiveness, maintaining that vision of where you're wanting to go. I think that's probably what helped me get through it. There were times when I hated my PhD, but by the end of it, I loved it, and I love where it took me, and I am so grateful that I had that opportunity. I guess, if you're wanting to get back into research, again, maybe looking at what interests you, what skill sets you want to acquire. Do you have them, or is there a way that you can upskill? So things like a Masters of Public Health or a Masters of Health Economics, or those sort of things. But also, looking for jobs, talking to people, looking what's out there. And I guess what I said before is I don't always look for someone who's come from research and then stayed on. A lot of the people who I employ actually have come from different backgrounds, and I love the skill sets that they bring, because you can always learn how to do things. You can always learn how to do statistical analysis or database and things like that, but what I like is their experiences, their skill sets, that diversity. I think that's quite good.
Dan, did you want to add something?
I think I always, obviously PhD sort of gets a degree of kudos, but in some senses it's a start out degree you just learn how to do research, and you do a particular program of research to do that, but mostly you're acquiring research skills. And so you sort of need to know why you're doing that is probably the biggest thing. And so you have to have a good reason to be doing a PhD at the start, because there will become time, there'll come a point at some way halfway through and you think, this is rubbish, why am I doing this? And so you have to be able to remind yourself, oh, hang on, that's right, I'm talking about. I think you have to be clear on why you're doing it and what you see as it's a means to an end in a lot of ways. It's not an end in itself.
I think the other thing that I'd add in there is, I was trained in laboratory research. That was what my PhD was in. That was where my skill is. I do no laboratory research now because trying to juggle that with a clinical career is extremely challenging. And so it's meant that then I've had to actually really adapt and learn a whole new range of research skills that I never got during my PhD. So just because you've done a particular thing does not mean that that's what defines you, and you can constantly be learning and evolving and changing and picking up new skills along the way. The other thing that I would recommend is that if you're finding that you're not necessarily getting as much opportunity to do research as you would like because you have to, do a job that's going to pay the bills for a while, is to look for what are the opportunities that come along within that. And, like the COVID pandemic, it's taken over everybody's lives in the last few years. And it's meant, for me, I lost a lot of research time because you had to shift back really into a predominantly clinical focused role. But that's, you need to look for where are the opportunities in those moments and how can you still, get things out of that are going to, help to actually change practice, but also kind of, fulfill the curiosity that you've got in you, which is innate to everybody that wants to do research. It's essentially that you're really curious and you've got questions around you that you want to play a part in helping to answer. So where are those little moments? And it's meant I've now got a whole research program on telehealth. Never ever would have thought that I would ended up doing that. And looking at, health policy and service changes and how do we completely kind of re-deliver how we provide healthcare that can be much more flexible in terms of, building resilient health systems. As an obstetrician, never would have thought that I'd end up doing that. So look for those little opportunities, in other jobs, coming up with, we're not really sure how this goes. Could I maybe undertake some research in that and help to answer that for your employer and things like that? And you'll gain skills along the way.
Thank you. And the last question.
So my question is about developing skills in research and prioritising those skills developed. Obviously, there are many different skills that come into research as a whole. And if you're not quite ready to, say, do a PhD program, how would you prioritise those skills? And which skills did you guys wish you started earlier?
That's a great question. Would you like to start, Kirsten?
Well, I certainly wish that I'd had some training in epidemiology and statistics, because that now is kind of the predominant aspect of the research that I do. So I certainly wish somebody had said you should go and get some training in this at an earlier point in my career. But I think it just speaks to it doesn't matter necessarily, because so much is actually the thought processes. And yes, I've got lots of skills in lab research, but you can translate still what you've learnt in that space into other areas, and be open-minded and pick up lots of different opportunities and skills from people along the way.
Dan?
It probably depends on your situation, but I think a couple of things I would say is you've just got to take any opportunity to get involved. There's not a right pathway at all, and most of it is just being prepared to have a go, and it's like any sort of puzzle or any sporting skill. You start small and you move up through the levels. So, for example, if you're a medical student or a junior doctor, you just tell people that please, if there's any opportunity for me to be involved in research, let me know. I'm happy to work through data. I'm happy to fill in spreadsheets, and then you get involved, and then you sort of start to build a little track record for yourself, that sort of thing. But I think the biggest thing is just sort of, there's not one thing you should do. You should do something. one of my favourite quotes just after I finished my PhD was from when I got my first post-PhD appointment at uni. The professor of medicine at that stage said, "You've got to be prepared to kiss a few frogs," which means, you know, you can't make every post a winner. You've got to have a go, and occasionally it won't come off. But that's a lot of research. Doesn't go all the way through to, you know, Nature journal publication. You just got to start somewhere.
Very good point, Trish.
I would say I am continually relearning everything, every step of the way. It's like, oh, I've got to go back and learn how to do this, or I've got to go learn. And part of it is that you're learning from the things that didn't quite go so well, so it's always continually improving as well. But the other thing I've learned, and probably as you become a bit more senior, you recognise what your skill set is. What's your strength? What do I bring to the table? And yes, I can do statistics. Yes, I can do those things. But it's not really, there's someone who can always do it better. So what I bring is actually that clinical understanding, being able to understand the impacts on patients and how do you actually bring something into practice. So, you know, you will continually relearn, but then as part of the process you work out what you shine at, and that's, you know, you bring people along to supplement what you're not good at or what you're not as good at. And you learn from them, but you also can bring your own skill sets to it as well.
I think if I might just add to that, this is just a general comment, and I think it may not necessarily just apply to research. I think everything that you learn along the way will add value. And you might be surprised with what you learn along the way, and might be, you know, something from the clinical field or otherwise. It might be your daily interaction with a person, what you want to be, what you don't want to be. But if you keep an open mind about things, every little bit that you learn, you'll bring that to the table. If you sit and reflect on it for a bit, you bring the whole thing to the table from a different point. It may not just apply to research. I think that applies across the board. And yeah, so...
Well, I think the panel has given us so many new insights and different ways of doing things. Please join me in thanking the panel.